Welcome to our Behavioral Health webinar. May is Mental Health Awareness Month, so I thought that today it'd be a great opportunity to just shed light on the Behavioral Health Department at Longwood Pediatrics and the resources that we have and just talk about it a little bit more. Our guest today is Dr. Binney.
Good morning.
Yay! So I thought today we'll just talk a little bit more about Behavioral Health Department, and I'll just ask Dr. Binney some questions and we can discuss. How would you describe the Behavioral Health Department at Longwood Pediatrics and what we do?
Excellent question. You do so many things, starting from supporting families when they initially have new babies, maybe around different parenting styles or different behavioral problems that kids normally have, like toddlers. There's a lot of parent consults you can do. I think mostly people think about behavioral health as mental health, but I think of it as so much more than that. It's really what it says, behavioral health. We all have so many behaviors we might want to change, and sometimes we need support doing that. Plus, there's a lot we can learn about handling our emotions and any sort of difficulties we might encounter in normal life. Stress with school, stress with relationships, ideas about who we want to be when we grow up. Anything.
That's a lot, but yes, I think that all fits. Who's eligible for behavioral health services here at Longwood Pediatrics?
Everybody, including parents. So if parents want to talk about how they can best support their kids, they can do a parent consult. Sometimes we see toddlers, young kids, certainly our teenagers and college students. You don't have to have a specific big problem to come see behavioral health. You can just have a few things you want to improve or work on. Maybe you've been trying to manage stress better, or you want to change some habits. Then you could come for, 1 or 2 times. It doesn't have to be a big commitment.
And to kind of add to that too, I feel like we also do a lot of work with schools and other community resources, especially maybe referrals as well. But that's a really great way to describe it. I think you already answered this, but who could benefit from meeting with me or one of the behavioral health clinicians here?
Everyone.
I
I think I've learned so much from you guys, and everyone could. Sometimes I even encourage teenagers to just do a check-in, sort of a behavioral health well-person check-in. Are there skills that maybe I could use in my life that I didn't really even know I needed? I often describe it as, when you learn to play a new sport, you need a coach. You don't necessarily have a problem, but you want to be better at lacrosse or soccer or baseball, and you can't do that by yourself. So you have a coach and you practice and you work on it together.
I feel like that's a really good way of putting it, because I feel like a lot of our roles is also teaching. I feel like we do a lot of just teaching skills or just coping skills, or even just like someone to talk to, figuring out, I think, just more complex issues as well. I feel like everybody in different ages and developmental stages have different types of things that they're dealing with. So
definitely.
I love my job. Can you tell? Okay, so how would patients connect with a behavioral health clinician here, and do they need a referral from you to come see someone like me?
Good question. No referral is needed. It's often suggested at a checkup or a visit with their primary care provider that they check in with one of the behavioral health providers, but they can decide on their own. Parents can decide. You just make it like you make any appointment. You call and you ask for a behavioral health appointment. Do you know if they can book them and schedule them themselves?
You can. You actually can, especially if it's been suggested before. If, say, maybe you and Dr. Binney or your PCP have talked about potentially accessing behavioral health, send a message on my chart, and one of the schedulers here would be very happy to help you. I feel like the other piece too that could be good to talk about is a warm handoff and how we meet our patients that way. Could you talk about that a little bit more?
Sure. Sometimes I'm seeing a patient and we start talking about something and I think, this would be a great topic to talk about further with one of the behavioral health clinicians. And they happen to be available right now. So why don't we just at least have you meet them? And I think sometimes that really helps break the ice, make people a little bit more comfortable, realize it's not such a scary thing to do. You can meet for a few minutes, sometimes even actually, have some suggestions about whatever the issue was and actually do a little bit of work right then and there. And I think that really helps people decide this seems like something I would be interested in, and Rachel's actually not scary at all.
No, I'm not. It could be just as easy as Dr. Binney just sending me a text or knocking on my door and hey, I have this patient that's kind of just interested in meeting with you and is just dealing with something like this. And we could meet that way too. So there's plenty of ways I think to access us here.
And also I think it's important to say that these can be in person or virtual.
Yes.
It's very busy schedules and hard to get in here. And so it's good that you can just pop on. Actually, a lot of our patients also will have some time during their day at school and be able to go to the guidance counselor's office or find a private space and fit it right into their day. So
A lot of schools are really accommodating with that, actually, I find.
It's great. It's really great.
How do you feel like behavioral health department integration support your work with your patients?
So many ways. Number one, sometimes I just ask you a question about a patient of mine, like, oh, hey, what do you think about this? Is this something that you could help with? Or sometimes you just give me an idea, like try suggesting this idea. We learn a lot of different things, or at least I certainly have learned so many things from you. And then you can give me feedback, and a lot of times you refer people to me that I didn't even know you were seeing. And then, we can all work together.
I feel like the work in just collaborating with you is so important, long-term and short-term, because a lot of times there's also just information that I might need. And a lot of times it's not even behavioral health related, right? Sometimes patients just might have questions that they're not comfortable asking right away. And sometimes just a really good way to break down those like really difficult subjects too with your pediatrician, because they always understand.
I will say one thing that I think it's helpful for my patients to hear is sometimes people with are a little afraid to bring up bigger topics or things that give them stronger emotions, and they think like, I don't want to talk to anyone about it because I'm really overwhelmed by it. I usually try to share with those people that like you can talk about as much or as little as you want with you, and you can just take little tiny bites around the edge, or maybe just go once and see what it feels like. You don't have to dive in and tell you everything the first day and feel like, we're going to solve all the problems.
That would be kind of weird and a little unrealistic, I think. To add to, I feel like I've seen patients range like one time and they feel like they got what they needed. Yes. But I've also seen some patients, maybe 10 times and we're still finally just like getting into the work. But I think the relationship building is so important. And that's not something I'd ever want to sacrifice just because you think you're only going to meet with somebody like once. How do you feel about just how we work when it comes to handling a crisis?
So sometimes crises happen in the middle of the day, or a lot of times at the end of the day, or there's different things that happen. And I think everyone is very flexible about that. And I know you have done extraordinary things after your hours here, stay late, call families, have them come in, greet them, welcome them. Often we'll, depending on the situation, take them over to the emergency room together, or whatever's necessary, call different extra resources in the community, talk to schools, fit them in the schedule. So there's a lot of ways, but usually it's above and beyond, and it's great for us to have that here.
I think a lot of that is also the culture here. I think everybody just goes above and beyond, and I know I'm not just speaking for myself or Dr. Binney. I think everybody here prioritizes both like physical health and mental health as well, and we want to be as accessible as possible. So last question is, how do people just get started? How do you find people get started if they're not interested, or maybe they don't even know that this behavioral health department exists?
I think that it often comes up at checkups. We usually talk about this sort of thing at all the well-visit appointments, and often I'll say, even if there's no specific topic they need to talk about, I just let people know about it, so that at some point in the future, if they're feeling like something would be useful to talk with you about, usually it often starts with like school issues or friend issues or something where you're like, I don't quite know how to navigate this, I could use some support. They can just call, or like you said, send a MyChart message, which sometimes feels a little bit easier. Or I often will, at the visit that I'm in, I'll send the message, please call this person to schedule an appointment. I usually do encourage an in-person visit as one of the first few, just because you get a better sense of each other. It's nice because the visit doesn't have to be like every Tuesday at 2:00. You can kind of work with your schedule. It's usually not every week. And that way there's lots of opportunities to sort of keep that going.
Well, thank you for answering all of our questions. We're hoping to have more of these in the future. If you have any topics that you're interested in, or any topics that you feel like we should address, or like you want to hear more about, feel free to just let us know. Thank you. Thank you, Dr. Binney, for coming.
Welcome.